welcome you to this kickoff event. Healthcare, we all know, is a critical issue. It's one that people are talking about all over the country. It's one that our political candidates running for every office are talking about. We think they should be talking about it more. We think they should be talking about the various solutions that are on the table. We want this election to be a referendum on healthcare. And in a brief time this afternoon, we're going to talk about what we see as the problems, what we see as the solutions on the table, and what kind of nationwide movement we hope to build to bring quality, affordable health care for everyone. First person to speak today is Liz McElroy, who is the political director for the AFL-Central Labor Council in Philadelphia. I should say that the AFL-CIO is a co-convener of the Pennsylvania HCAN movement with SEIU. Liz?
Thank you, Marc. As Marc mentioned, my name is Liz McElroy. I'm from the Philadelphia AFL-CIO. And when we talk about healthcare and healthcare problems, a lot of times in the country we talk about the uninsured, and it's a travesty. We can't forget that there's so many uninsured. But we also need to talk about everybody, the insured as well, because it's all of our problem. This is why AFL-CIO is part of the HCAN initiative. A third of us who have health insurance report that we're worried about losing it. And in 2006, a survey done reported that 25% of American families said they had trouble paying for their health care that year, for their medical care that year, and 2/3 of those families had health insurance. So clearly this is not just a problem about being uninsured, it's a problem for all of us. Health insurance premiums are rising at 3 times the rate of wages. This is one of the problems Marc was alluding to. And the cost of family premiums is expected to double from $12,000 a year right now to $24,000 a year by 2016. The AFL-CIO knows that this is an unsustainable system, and that's why we're part of the reform movement. We want to talk about solutions. We want to talk about how we can get there in a timely fashion, in a fashion that's fair to everybody. And we believe Healthcare for America Now is the way to go.